My name's Wendy Miller. I'm an Associate Professor in Energy and Buildings in the School of Architecture and Built Environment at Queensland Uni of Technology, and I'm Activity Leader for Living Labs in the iHub project. A key problem that Living Labs wants to solve is the commercialisation of emerging technologies. I think it's important for emerging technologies to be able to have their products tested in a real building with real users. It's one thing for a technology to work well in a lab, but you want to know, do the facilities managers know how to operate it? How easy is it to install? What are the financial benefits of it to the host organisations?
I'm Dr. Georgios Kokogiannakis. I work at the University of Wollongong. I'm the co-leader of the Living Labs activity stream of iHub. We also work together with our partners at QUT, because the Living Labs are coordinated by the two institutions, and with CSIRO, bringing together Living Labs and the Data Clearing House. We looked into three main issues. One was looking into heating, ventilation, air conditioning systems that helps the transition from gas to electricity. We looked into demand response and wholesale spot pricing for HVAC systems, and finally we undertook a comparison between modern transportable classrooms compared with those old transportable classrooms that we see in many schools these days. The electricity market for enabling demand response is very complex, we found. That complexity makes it very difficult for building managers to really trial the possibilities that they are out there to enable demand response in HVAC systems. So our team really brought together industry that can enable this to happen, together with a portfolio manager from Warrigal in this case, that really trusts us and trial this and take the risks and demonstrate the benefits from that. So the Living Labs really demonstrate that it is possible to, if one technology works in one building, then you can start replicating that elsewhere.
The Living Labs really are heavily dependent on having good partners, and the first is the host organisations who are willing to have technologies tested, so the likes of the Queensland Children's Health, Bolton Clark, Warrigal, and ACT schools. So we had to find the host and get them to say yes, they were prepared to have their buildings as a living lab. And then there were two steps involved in the setting up of those labs. So we worked with University of Wollongong to develop an overall framework of how will a living lab operate, and then we applied that framework to each of the specific living labs.
The Queensland Children's Hospital is a vertical hospital. It's Queensland's only tertiary quaternary children's hospital, and we take patients from northern New South Wales right through to the north of Queensland. So we've got about 354-ish beds over the 12 stories of the hospital. That gives us a smaller footprint, but it does give us less opportunity to put things like solar panels on the roof, because the roof is almost taken up by the helipad.
In total, we have about 4 or 5 technologies assessed. So we have implemented digital twin technologies for our chiller systems, and we have implemented and tested graphene-based coating for our outdoor refrigeration units. And also we have implemented another digital twin technology for our Centre for Children's Health building within our QCH, Queensland Children's Hospital Living Lab precinct. First, we evaluated a range of strategies that can be used to improve our chiller systems operation for the whole precinct. Because we are in subtropical or even maybe for tropical, chiller system or the cooling system is often the number one energy user. That's why we focused our digital twin in our chiller system. First, we acquired data from site, for example, the chilled water flow data, temperature data, and then the technology provider used the machine learning algorithms to simulate, combined with thermodynamics, to model a range of different scenarios, operation conditions, and outdoor environment conditions, and figure out what's the best setting or control logic for our chillers. And in that way, they recommended 3 different sets of operation improvements we can contribute.
One of the advantages of using a digital twin is that I can do the work without physically touching the plant. So we can look at what happens first, look at the flow rates, get all our data together, look at the potential for energy savings, look at the risk. We've got 6 chillers, 5 large and 1 small, to supply chilled water for the hospital. If I introduce chiller sequencing, what are the risks if it doesn't work and I get stuck with no chillers and no chilled water? And so the chiller sequencing was really important for us, because the switch from small chiller running at full load, then switching to the large chiller and shutting off the small chiller, and then as the load increased, bringing the small chiller back on, and then dropping the small chiller and bringing on a second large chiller, has really improved the efficiency of the way those chillers work.
The chiller station helped us save 3 to 4% of the site energy use. The percentage does not seem to be high. However, if we talk about the whole precinct, Queensland Children's Hospital precinct, yearly use of 26 gigawatt hour of electricity use, and that 3 to 4% is equivalent to maybe tens or hundreds of households' electricity use. So it's not a small amount.
Energy costs to any health service are a really major factor. Important factor in that a busy hospital and health system pretty much runs 24/7, and it's important for a safer community. So for us, the energy costs after you pay the staffing bill are some of the major expenses and investments that you make. So the net zero and energy efficiency, sustainability, and even really looking at carbon neutrality and renewables really is very, very important to us as a key leader in the health system in Queensland. I think application in real-world examples and real-world businesses is really, really important. The benefits are just immense. So the opportunity to partner with, one of the premier unis in Queensland, and the fact that it's just across the river, you can't get a better fit even if you wanted to design it that way. So the more work that we do in that collaborative and partnership space, the better it gets for us. And the goal for us really is that it's not just a once or a twice. It's really part of a long-term, probably multi-decade research R&D program that had the beginning in some of that iHub bid originally.
Whilst the 2 Living Labs in Queensland tested, I think, 8 different technologies, there are another 8 or so that we didn't test or couldn't test for a range of reasons. One of the lessons from Living Labs is that no one Living Lab building can be suitable for testing all technologies, and maybe it's worth thinking about how every building can be a living lab. If, for example, all government buildings had to provide their energy data, how they use energy, where, what technologies they have, that might be sufficient learning for at least some technologies to be able to fast track throughout the broader built environment. It might also be that buildings that put in a new technology, such as specialised glazing or special chillers, for example, that they report their findings broadly, even if the technology doesn't work as well as what they expected, so that we can all learn from each other rather than waiting for everybody to make the same mistakes over and over again.